Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. MALLOR GRODNER Attorneys providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Alumni Association connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. Alumni.iu.edu. IU Center for Rural Engagement extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. Rural.indiana.edu. And by WTIU members. Thank you.
Coming up on Indiana Newsdesk. The state is expected to lower the age requirement for Hoosiers seeking to receive the COVID-19 vaccine sooner than later.
We'll continue to clamor for more up and until every single Hoosier gets the vaccination that they're asking for.
Ahead, what that means and what precautions you should still take after getting the vaccine. Passing COVID-19 liability protections is a priority for Republican lawmakers, but some worry it could strip the rights of workers.
And basically say, I'm going to trust an employer to do everything possible it can do. I just don't agree with that.
With opioid deaths on the rise during the pandemic, the Indiana State Museum has created an exhibit about the drug and its effect on users. Those stories, plus the latest news headlines from across the state, right now on Indiana Newsdesk. Welcome to Indiana Newsdesk. I'm Joe Wren. Indiana officials say the state will begin receiving more COVID-19 vaccine doses, but not enough to open up appointments to more people. Federal officials told the state this week to expect a boost of about 13,000 doses a week. It currently receives about 80,000 a week. But the only Hoosiers who can schedule appointments will remain those age 70 and older.
We have identified approximately 4,500 individuals age 70 and older whose first dose appointment is scheduled after March 1st. Our partners at 211 will be reaching out to those people via email and phone calls to help them schedule an earlier appointment.
Governor Eric Holcomb says the state hopes to open appointments to those age 65 to 69 within days, not weeks. Well, having enough of the vaccine continues to be a major issue in the fight against the pandemic. Pat Bean reports on what you need to know about getting the vaccine and what that means for returning to normalcy.
The slow rollout of the vaccine across the nation has been frustrating for those longing for an end to the pandemic that has been raging for the past year. In Indiana, wait times to get the vaccine can be up to a month, and the state is still vaccinating only healthcare workers, first responders, and those 70 and older. Even with the promised influx of more doses on the horizon, Lana DeBabo, the director of vaccine initiatives for IU's COVID-19 medical response team, says it will be months before enough people can be vaccinated to reach a herd immunity.
The faster we can do this, the better we are off as a country, so that we can start our trajectory or our journey back to normal.
DeBabo said that although the vaccines have shown to be 95% effective, they don't reach that level of protection until 2 weeks after the second shot. So, while you may be partially protected after the first dose, and even more so after the second, you still need to follow the CDC guidelines of using preventative measures against the virus.
I'm more than 2 weeks out of my second dose, and I continue to do the same, work from home, social distance, and wear a mask. And I would encourage people not to think of it as, okay, well, the vaccine didn't change anything. It actually does. It makes me personally not susceptible to getting severely ill, and that is a huge step forward.
The next step in the state's immunization plan is for those 65 and older to be eligible to get the vaccine. Governor Eric Holcomb hopes that will begin within days.
We are protecting the most vulnerable people who are dying. They will never get a second chance at this. So I really appreciate that approach.
DeBabo says getting everyone on board with getting the vaccine is critical to reaching a herd immunity. And while DeBabo says with the vaccine there is light at the end of the tunnel, now is not the time to relax in the fight against COVID-19.
It is more important now to practice those because we have new variants and new mutants that are risky, that have higher transmission rates, And when we see higher transmission, that always is followed by higher deaths.
For Indiana Newsdesk, I'm Pat Bean.
There are many locations to get the vaccine, including Kroger stores. However, the same age restrictions still apply. Meanwhile, the virus outlook in Indiana is improving. The state's 7-day positivity rate fell below 9% this week for the first time since mid-October. Beginning Monday, the governor is relaxing the state's crowd size limits.
We can control the things that we can control, and we can manage our way through this. We know what works, but it is a constant balance of our lives and our livelihoods.
The state will continue to use its color-coded county map to determine capacity restrictions. Holcomb says gatherings in red and orange counties can be up to 25% of the facility's capacity. All the state's 92 counties are currently under red or orange restrictions. Now, the U.S. Penitentiary in Terre Haute is making headlines again this week. The Associated Press revealed Wednesday that the Bureau of Prisons failed to disclose 2 journalists covering executions tested positive for COVID-19. The Bureau knowingly withheld that information from other journalists who were potentially exposed and conducted no contact tracing. Those 2 journalists are my colleagues, Adam Pinsker and George Hale. Since this summer, they have been covering the federal executions in Terre Haute. George joins us now from his home where he's been isolating for 10 days. George, I understand you were the first to test positive. How did you find out?
I found out through routine testing that Indiana University conducts as part of our, way to protect the campus, and as part of our office's way to protect the newsroom from, infecting others. And so we always make sure that we get tested when we return to Bloomington. So I got tested the Tuesday after the final executions and found out 2 days later on Thursday.
Do you know how you were exposed?
We don't know for sure. The health department registered my symptoms as beginning the Saturday we returned from Terre Haute. That means it could have been possibly a little bit sooner than the executions, or it could have been during that week. We were there all week for about 5 days, covering 3 different executions.
When did you notify the prison bureau about that test?
About 4 hours after I received it.
So were you able to find out why the government didn't take any action, and are other reporters concerned?
Yeah, so the prison bureau said that it would have conducted a contact tracing procedure if we had notified them within 2 days of of the symptoms being felt. And so since the test was 3 or 4 days after the last execution, in their view, it was not necessary to inform anyone. I think it's important, though, that to point out, though, that since my symptoms technically started the final day of the execution, it was a few hours after it ended, about 12 hours later, I sort of got ill. So, theoretically, I was exposing people to the virus the entire time I was there for that final execution. So we were obviously very concerned about the well-being of, the other journalists and even the staff.
We're just under 30 seconds, but you've been reporting on the execution-related COVID outbreaks in particular. How does this connect to litigation over the prison's COVID policies?
Yeah, and it actually was the sort of just the latest development in a long sort of string of issues where the Bureau of Prisons has been claiming that they're taking precautions while defense attorneys and journalists like myself insist that they're not.
Well, George, thanks for joining us, and we hope to see you soon back in the newsroom.
Thanks, Joe.
Well, after the Indiana General Assembly's week-long pause amid security concerns, lawmakers were back at the State House this week. A priority for the Republican majority is passing COVID-19 liability protections for businesses. It's a move many states have considered and pro-business groups support. The Senate took the first step, passing a version of the bill yesterday, but as Brock Turner explains, some of the House version could severely limit the rights of essential workers.
David Bride and his family have been union workers for decades. He works for the city of Indianapolis, and his wife is a nurse. Remote work in their household was never in the cards.
The workers who put their lives on the line, like my wife, my grandson that works at the grocery store, a union employee, we have to always have a voice where we can say, hey, this is not safe.
Bride, his wife, and thousands of other essential workers have kept working in person since the pandemic began. Estimates from the United Way show more than half of Indiana's workers are considered essential. While some are able to work remotely, many, like Bride, don't have that luxury and are concerned about extending broad COVID-19 liability protections to employers. Bride, who also serves as the president of the Central Indiana AFL-CIO, says his employer, along with many others, are taking the proper precautions, but he knows that's not the case everywhere.
It's essential that if you are an essential worker, that you feel that your job, your employer is going to make sure that you're safe.
Experts have mixed feelings on how legislative language could affect workers and businesses across the state. The Senate bill, authored by veteran GOP lawmakers Mark Messmer, Eric Cook, and Liz Brown, would, among other things, prohibit civil tort cases that don't meet the gross negligence threshold. Jody Madeira, a professor at Indiana University's MALLOR School of Law, says the legislature is free to constrain the types of harm about which you can sue. She says the Senate bill strikes a balance between competing interests.
This goes back to the fact that this doesn't prevent lawsuits altogether, right? Businesses will still have to defend and say, this is what we did that was reasonable.
But there could be unintended consequences.
So I do think it would have a chilling effect, particularly, plaintiffs themselves might think that they can't win the lawsuit, but lawyers might not take these sorts of suits.
Specifically, a cause for Madeira's concern are places like long-term care facilities that have been ravaged by the virus because of policies.
Those businesses or those organizations where people are not allowed in. So for example, if the nursing home or long-term residential care facility is sealed and you can't have visitors, it's going to be hard because no one knows how grandpa or grandma got COVID, right? Because no one sees grandpa or grandma and no one sees the nursing aides that come in or things like that. And really there, gross negligence will be premised on the sheer volume of cases that come up, and perhaps the investigations that state authorities would do, but one would have to file a Freedom of Information request to get access to that information.
Indiana has implemented facility-first policies throughout the coronavirus pandemic, which has led to disdain from caregivers. While a cadre of industry groups testified in favor of the bill, not everyone is on board. Neil Gath is an attorney that represents the Indiana AFL-CIO, a group that advocates for more than 50,000 Hoosier workers. He worries the bill sets the bar too high for the average worker and has even greater concerns with the House version of the bill. If passed, the House version would forbid courts from recognizing local, state, and federal mask mandates. Experts say the mandates could still be argued, but it would be more difficult for plaintiffs. Additionally, House language would require plaintiffs to find an Indiana or surrounding state physician to testify on their behalf. For Gath, this language places the needs of businesses over the rights of workers.
If someone followed the rules and did the proper precautions, we think they have an argument for immunity. If someone flouted the rules, didn't follow the precautions, why should they get immunity for their actions?
While Madeira supports most protections, she believes requiring physician testimony could create inconsistent rulings or even a cottage industry. Both she and Gath say courts will have to interpret how to apply whichever language is passed, and he has a hard time thinking about how to argue these cases for clients.
You'd have to show a very high standard of negligence or intentional conduct by significant evidence. So, it would be multiple high hurdles. You would have to have very certain facts, both medically and in terms of exposure and carelessness, in order to meet that kind of burden.
Bride understands the need to protect businesses, but grapples with how it affects.
So they're in these environments that are risky, and for you to take that away and basically say, I'm going to trust an employer to do everything possible it can do, I just don't agree with that.
He worries the legislature will side with businesses and ignore the rights of Hoosier workers.
This is not safe. If you put something in place where an employer doesn't have to worry about consequences of their actions, then that's not good for workers. And that's not good for Indiana.
Legislators and trade groups insist they're not trying to limit worker rights, rather shield businesses from burdensome lawsuits. More than a dozen states have already passed some type of COVID-19 liability protections. For Indiana Newsdesk, I'm Brock Turner.
Coming up next on Indiana Newsdesk. Opioid deaths in the state are on the rise during the pandemic. Ahead, the Indiana State Museum has created an exhibit about the drug and its effect on users. And the city is reviewing a historic designation for the Players Pub. What's next for the building, which has a complicated racial history as well as a deteriorating infrastructure? These stories and more right here on Indiana Newsdesk.
Stay close to Indiana Newsdesk as we trace education issues all the way from the Capitol to your child's classroom. So many topics that arise each year in the State House affect what happens every day in the schoolhouse. The WTIU News Team is committed to helping you stay up to date with the issues that affect your family's future. Keep yourself informed. Tune in to Indiana Newsdesk, your source for regional and state in-depth news.
The COVID-19 vaccine is here. It's safe, effective, and it's our shot, Hoosiers. Seniors, long-term care residents, healthcare workers, and first responders are now eligible. If you or someone you know qualifies, go to ourshot.in.gov. Or for seniors, call 211 to learn how you can receive the vaccine. But remember, we need to keep wearing masks and following other protective measures to keep everyone safe. Because it's our shot, Hoosiers. Sponsored by the Indiana Department of Health, aired in cooperation with this station.
Welcome back to Indiana Newsdesk. We're going right over to news headlines. Ethan Burks joins us with the latest on this week's top stories.
Thanks, Joe. Lawmakers are preparing for a special session this summer to draw new maps for congressional and General Assembly districts. Data for last year's census is delayed and won't be done until late April when the session adjourns. The U.S. Census Bureau is aiming to deliver population figures used for divvying up congressional seats by the end of April, with legislative district information sometime after July. The Indiana Black Legislative Caucus says it's pleased with progress so far this session on its agenda for police reform. Indiana Public Broadcasting's Brandon Smith reports on the status of 20-21 crime bill.
The major police reform bill of 2021 is well on its way, supported by law enforcement, public defenders, and key organizations in black communities. The measure requires de-escalation training for all police officers, it treats chokeholds as deadly force, and it allows the state training board to decertify officers who commit misconduct. Other parts of the Black Caucus's agenda gaining traction include a bill to create a law enforcement misconduct database and an extension of the state's current traffic amnesty program, allowing drivers to more easily get their licenses back. Black Caucus Chair Robin Shackelford says conversations with Republican leaders have been productive, and she's pleased to see Governor Eric Holcomb's administration working behind the scenes on the issue, though she wishes he were more out front, too.
To help put a face on the issue and let people know that the leader of the state is behind most of this agenda and willing to help out, I think that would greatly help.
Shackelford says she hopes the major police reform bill remains unchanged as it moves through the legislature. For Indiana Public Broadcasting, I'm Brandon Smith.
Nearly half of the inmates at the Bartholomew County Jail have tested positive for the coronavirus in the last week. A strike team from the Indiana Department of Health came to the jail over the weekend to test inmates and staff. 4 inmates who refused to be tested were put into quarantine. The jail is on lockdown until at least the end of February, according to a statement from the facility. Inmates with fewer than 30 days left on their sentences will be released early if they are not deemed to be a threat to the public. 2 similar bills intended to ensure schools receive full funding for all students during the pandemic are back on the fast track for passage in the legislature. The proposals would fully fund traditional public schools for any virtual instruction during the current school year. But virtual school supporters are now asking why a reduced funding rule exists at all for regular full-time virtual schools. Current law caps per pupil funding for students who take at least half of their classes virtually at 85% of full in-person student funding. The bills for this school year's funding are temporary fixes because they would expire at the end of the semester. A state Senate bill that would remove protections for state-regulated wetlands in Indiana passed out of committee this week. Supporters of the bill say the state's unnecessary wetland regulations have driven up some home prices and caused headaches for farmers. The Indiana Department of Environmental Management opposes the bill and says the state has already lost about 85% of its wetlands, which play an important role in Indiana.
flood reduction, water storage, water quality, and wildlife habitats. Wetlands also absorb snowmelt and seasonal rain, replenishing groundwater.
There are some federal laws that regulate pollution in wetlands, but Item says because the Trump administration changed the Waters of the United States rule, now the majority of wetlands in Indiana aren't regulated under the rule. And this week, Bloomington City Council reviewed 2 properties for historic designation: the Court Administration Building on the Bloomington Hospital property and the old Players Pub building. The core building received positive feedback as the city believes it can be turned into a housing complex after the new hospital site is redeveloped in the future. But the Players Pub did not. The building has a complicated racial history as well as a deteriorating infrastructure.
Sometimes these race-related or historical race conversations are very difficult, but I think they're necessary.
Before becoming what most people know today as the Players Pub, the building was Boxman's restaurant from 1929 to 1958, and like many restaurants in Bloomington during that time, people of color were not allowed to dine there. The council says that troubling history, mixed with the building's poor condition, mean it should not be eligible for historic preservation. Both buildings will be up for a final vote next week. And that's all for this week's headlines. Back to you, Joe.
All right, thank you very much, Ethan. Opioid usage has skyrocketed in Indiana during the pandemic, and the Indiana State Museum wants to get the word out. Lily St. Angelo reports on an exhibit currently on display at the museum.
More than 800 Hoosiers died in the first 6 months of 2020, according to Indiana Department of Health preliminary data. That's a 41.4% increase compared to the first 6 months of 2019. Emergency room visits due to overdoses were up 52.7%. But even before the pandemic, the opioid crisis was taking hundreds of lives every year in Indiana. Museum CEO Kathy Faree took notice and asked the community how the museum could help. Based on feedback, the museum opened an exhibit in February called Fix: Heartbreak and Hope Inside Our Opioid Crisis. Museum exhibit developer Kathleen Donnelly said the exhibit informs visitors about the drug and its effects on users. The exhibit is also intended to reduce the stigma of opioid addiction.
There's so much stigma around the disease, and we're trying to help people understand that this is a disease, treatments are available, and recovery is possible. So we're trying to help people have that empathy to reach out and help other people, particularly if they have a loved one or a neighbor or a friend who's suffering from opioid use disorder.
Walking into the exhibit, visitors learn about the science behind opioids and the history of their use. Although it can't be confirmed, Mary Todd Lincoln is thought to have suffered from an opioid use disorder.
It's surprising to many people to realize that it goes way back to the Civil War, when people were actually, particularly veterans who were returning from the war, had experience with opioids, and then it was very difficult for them to recover from that. And that kind of ballooned into a crisis similar to that we have today, but it was well over 100 years ago.
Another corner of the exhibit helps kids understand pain. People are sometimes prescribed opioids for pain relief, but according to the Mayo Clinic, they are safest when used for 3 days or less to avoid addiction.
Your nervous system is fine-tuned to pain, reacting faster than your conscious thoughts. Ready? Keep your hand on the sphere. Don't move. Just 1 second. Here it comes. Just kidding. You weren't really shocked.
Throughout the exhibit, story booths allow visitors to listen to the stories of 16 people who are in recovery from an opioid addiction or have a loved one who is affected.
I don't think that I can make it through this without a little bit of help.
I did not have personal experience with this, but certainly meeting the people who came in for the interviews, we did a lot of interviews, and the stories were really amazing. And these are people who are, for the most part, like I said, are in recovery, and they've overcome enormous odds to get where they are today.
The last part of the exhibit highlights the recovery process. Interactive areas for yoga, music therapy, breathing exercises, and creative art show visitors different methods for handling stress, a key lesson in the recovery process. The 4 dimensions of recovery are making healthy choices, having purpose, having stable housing, and being in community with others. Donnelly said the extreme increase in overdoses in Indiana during the pandemic may be linked to people not having access to some of these key foundations. For Donnelly, talking to people in recovery has given her a new perspective on the opioid crisis and hope for those struggling with addiction.
It's a problem that is not insurmountable, it is treatable, and hope is there.
One way the exhibit urges the public to help is through training in administering naloxone. The museum lists upcoming trainings happening across the state on the exhibit's website at indianamuseum.org. The exhibit will run through August 1st, 2021. For Indiana Newsdesk, I'm Lily St. Angelo.
Feelings of pleasure and decreasing feelings of...
And that's the end of this program, but our work continues online as we cover the news throughout the week at WTIUnews.org. Have a great weekend.
Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. MALLOR GRODNER attorneys providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. lawmg.com. IU Alumni Association connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. alumni.iu.edu. IU Center for Rural Engagement extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. rural.indiana.edu. And by WTIU members. Thank you.